A growing concern today in the male population is the issue of testosterone, or what we call low T. And as folks come in and they ask me, what can I do for low T? Give me something I can take for low T. Well, when you look at health problems, you want to get to root cause. And many times, if you take away that root cause, then the problem resolves and you don't have to take something and manage it or mask it like we do with medications. According to Cleveland Clinic, 40% of men 45 or older have problems with testosterone. I've had fellas come in their late 20s and have a testosterone in 160, 170, and it should be up in the 700s. So what are some major causes that cause the testosterone to drop based on lifestyle? The first one we look at is obesity, especially visceral fat. As visceral fat goes up, estradiol goes up. As estradiol goes up, testosterone goes down. So keeping him within ideal body weight is very, very important. Another problem that we see in lowering testosterone is where fellas go back and forth and they're swinging. They gain weight, they lose weight. They gain weight, they lose weight. Well, losing weight rapidly actually will also lower your testosterone. So as you lose weight, lose it smart. Lose it slowly as you're dropping that weight. It will help with that testosterone. Another one is sleep deprivation. And there's two issues there. One is not going to bed, where people just don't get sleep. They get not enough hours. But the other is sleep apnea. And sleep apnea is an issue of where folks, they wake up a lot at night due to their O2 saturation dropping down in 88, 89, and the body goes, "Wake up, Henry." And it wakes them up, and then they go back to sleep. And then it drops down, wakes them up, they take some air, it goes back up, and they're doing that all night long. Some people as much as 700 times a night. And so that's why they put them on a CPAP or a BiPAP to keep that oxygen up well so that they have that uninterrupted sleep. So whether it's you're not getting enough sleep will lower your testosterone, and a lot of folks aren't going to bed till midnight, 1 o'clock, 2 o'clock, and they're getting that 4, 5, 5.5 hours sleep. Or the other issue is where they're not having that good solid sleep all night long, which is due to, say, sleep apnea, or it could be they're getting up, going to the bathroom, getting up, going to the bathroom. It's interrupting that sleep. Another problem we see is alcohol. And as we see stress raising out there today, and soon stress, according to the World Health Organization, is going to be bypassed by another health concern, and that is depression. And soon depression will be the #1 diagnosis in the United States, according to WHO. With that depression, with that stress, we see a lot of consumption of alcohol. As we see the issue of coronavirus, we're seeing the issues of depression out there, people losing their jobs. I have a guy on the fire hall right now. He's lost his job. He's got to make car payments. He's got to make house payments. His wife's in school and they're trying to figure out what to do. And many folks out there are having challenges right now. And with that depression, there is that tendency to use alcohol. Another one is medications, especially the opioids, the hormones, and the steroids. Those items will affect the testosterone. And so take a look at your medications. Folks will come in with health issues. The first thing I want to look at is, are they on medications that the side effect could be causing that? Another one is antibiotic steroid abuse, and men will use that when they are working out, and that antibiotic steroids will maybe make them a little stronger, but it can dump that testosterone. Chronic endurance exercise, and that's a problem out there in folks who do a lot of cycling, a lot of running. It's good to exercise, and actually exercise is a way to bring up your testosterone, but you've got to exercise the proper way. If you're doing that aggressive exercise for long periods of time, like jogging, long periods of time, or cycling long periods of time, those type of exercise can actually lower your testosterone. And one's inevitable. As we get older, we're going to produce less and less testosterone. And so those young bucks that are in their teens, their 20s, they should be up around 700. And as we get older, it starts dropping and dropping. As we get older, we don't have the energy. And so we're looking, how can we increase our testosterone? Well, there's actually a way, and we'll talk about that in just a little bit. Another one is diseases. Different diseases can cause different problems. And so you have a primary disease which can cause a secondary problem. Now let's look at these primary concerns that actually can lower testosterone. Type 2 diabetes, cirrhosis of the liver, HIV or AIDS, hypothyroidism, hemochromatosis, that's too much iron in the body, dysfunctions or tumors of the pituitary gland, chronic renal failure. And we're seeing more and more renal issues out there. Why? Has a lot to do with their diets. Or it could be a person's had a head injury, chemotherapy, or it could be trauma or interruption in blood supply or infection in the testes. Can we affect any of it? Can we address any of these? Actually, we can. Diabetes, can we reverse diabetes? Absolutely. We're going to talk about that today. Can we address cirrhosis of the liver? Absolutely. I had a lady several years ago that came in, and she told me, she says, Walt, my doc said there's nothing else we can do. I have cirrhosis of the liver, and he told me to prepare to die. And we did milk thistle. We did dandelion. We did juicing. And for her jaundice, we used bentonite clay. And that has been probably 15 years ago. And that lady's doing still great today. Actually, the liver, cirrhosis of the liver totally went away. So as we apply God's natural remedies, and we take that cause away, you know what our cause was? Alcohol. We took the alcohol away, we gave God's herbs that build the body back, and God blessed. And the cirrhosis of the liver totally went away. HIV and AIDS, it's a little more difficult, but you can definitely keep that body as healthy as possible. Hypothyroidism, there's things you can do to keep that thyroid working as well as possible, that TSH in range, the T3, T4, the antibodies, the free T3, the free T4, making sure those are kept, whether you're using it by medication or supplementation, keep those numbers in the proper range can be a huge help. Too much iron in the body. Well, we can do things like don't use an iron skillet, or maybe you need to give some blood. And chronic renal failure, we're finding excellent success as we address lifestyle in improving that renal failure issue. Head injury, that's something that's there. Infections, yes, we can address those infections. So as you look at the causes of the low testosterone, you want to do a good invoice of that and try to figure out, is it something that you can change, such as your ideal body weight, the way you exercise, or the alcohol, or losing too much weight. There's a lot you can do to address that so that you can bring that T up. We'll talk a little bit in a moment about how you can bring that T up with supplementation and different things, but the biggest thing is take those causes away.